Dr. Kristie Ennis. Today's video is all in the hips from one of my favorite movies. If you know what it is, put it right in the comments below. Now, if you've had back pain or currently have back pain, the hips actually, because of where they attach and how they help us move, play a really big, almost a starring role in back pain, more so even sometimes than the back muscles themselves. They can be tight or they can be weak and cause a problem. Today, we are going to work on the tightness and how to loosen those up to get that back feeling much better. All of our stretches today are static stretches, meaning we're going to hold them, so that you do want to make sure you get a little blood flow going through that body before you jump right into those stretches. So one of the things that I tend to do is use my Derma Edge, which I'll link here for you. I made this. And to get a little blood flow going through those hips, just by doing some nice little gentle strokes. If you've been able to move around during the day, awesome, you'll have some blood flow going that way too, or if you've done a little yoga, something like that. But just make sure that you do not jump right out of bed and start into these stretches. So our first stretch is going to be for the front of the thigh, or those hip flexor muscles. Now the hip flexor muscles actually dive nice and deep in through towards the belly button and then attach in several levels of the spine, so that when they're tight, they're gonna pull and yank on things and actually even tilt that pelvis, just like that. You can do a little dance. They also tend to be tighter more often than not than the hamstrings. Hamstrings can appear tight because the hip flexors are actually tight and pulling. That's a whole nother story, but we're gonna start with those hip flexors. My favorite way to stretch these is in a kneeling position, and you can have your wonderful dream pillow or other pillow. It's the left leg I'm gonna show you how to stretch. So that knee can go down on the pillow if you need a little extra support. This is not necessarily about balance, so you certainly can hang on to something if you need to. But from here, what you wanna do is get just a little pelvic tilt or pelvic tuck and squeeze into that left bum cheek. You may feel a stretch just doing this. If not, don't let that position go, and then you're gonna press it forward. It's a pretty small movement, but if you really, really lean into it, you get more into the capsule versus the muscle itself. To add a little bit more, you can even add a pretty ballerina arm move in there. And you wanna hold it for about 3 to 5 breath cycles. If kneeling happens to bother your knee or you just don't like kneeling, there are 2 other options, one being a standing stretch. So I'm going to use my little seat here. You can use your chair if you're at work or a step even. Same concept though. I'm going to put the right foot up since I'm stretching that left side, that little pelvic tuck again, squeezing into those glutes because that helps actually open up that area. And then coming forward without losing that tilt. And again, you can add that arm in there too. Lastly, if neither of those options works for you and you have a chair or again a bench without arms, then you can do this one seated too. So if we're stretching that left side, left butt cheek comes off the chair a little bit. And I love this stool. I'll link that below for you guys too, but it rocks so it helps out. And you're gonna drop that hip back and down a touch. You're already in a little bit of a pelvic tuck there, but you can add a little more, squeeze that bum. And for me, I can rock into it to see where that stretch feels best. If you don't have something that rocks, just think about kind of pressing forward. And again, you can add that arm overhead if you need a little bit more. Our second stretch today is focusing in on those glute muscles, multiple glute muscles actually. They tend to attach into that sacrum, part of that spine, also into the hip. So we're working on external or outer rotation right now. My favorite way to do that is lying on your back. You can do this in bed. You don't have to do it on the floor. Again, sticking with that left side, if I cross that left ankle over that right leg and just open that up a little bit, you may already start to feel a stretch there. What I like to do the best is pull this opposite leg up. You can use a sheet or a strap to help pull that leg if it's hard to grab that leg too. And then, yep, feels good already. If you need even more of a stretch in this position, you can bring those legs over towards the right, all while, right, opening up that knee. Same idea, 3 to 5 breaths to let yourself relax right into it. If that lying down one doesn't work for you, I'm gonna give you 2 other options, a seated and a standing one. So the seated one, if you can sit with those legs crossed, so if my right leg's in front, it's usually more of a stretch in the right. If the left leg's in front, it's more of a stretch in the left. And you might need to start nice and close. You can even support yourself with some blocks or a pillow here. But from here, you're just gonna reach it forward. Again, you'll get stretch on both sides, but it'll be a little bit more on that left side. To make that even more, bring that left leg out a little bit further. Or, now we're really looking yoga-like, if you cross that leg right on top, and again, gentle, right? None of these should hurt, keep that in mind. And then lean it forward. That's a super good stretch for me. And then, like I said, 3 or 5 breaths, just like the other ones, and then we'll move into the standing stretch. The last option for opening up that hip out is in a standing position. And I know some people that totally love this one. It is a little bit harder, a little bit more balancy, so you wanna make sure you have something that you can stand next to that's sturdy. But you're gonna cross that ankle, again, not directly on the knee, but above it. Try to open it up a little bit, and then you're sitting back into a squat. If you really wanna challenge yourself, look, ma, no hands, right? And you want to try to fold as much as you can comfortably. Remember, stretching is comfortable, not painful. I'll show you from the other angle. I'm not going to get out of this position as I'm in it. And again, right? So really opening up through that hip, feeling that pull right in through here. Our last stretch is going to be for the rotation of the hip in the other direction. So we worked on opening it. Now we're going to go in the other direction, which this poor muscle or these poor muscles often get neglected. But again, because of their attachment sites and helping to support the pelvis, they really need to be addressed as well. So my favorite way to do this is, again, lying down. This time I'm going to take the right ankle and cross it above that left knee. A little bit of opposite, right, of what we just did. And now I'm going to take and I'm going to press gently. You'll have less range of motion usually in this direction, okay? Just keep that in mind. Also try not to let yourself just roll right over, but a gentle pressure here, and again, holding that 3 to 5 breath cycles. If that first stretch was bothersome to the knee or any other part of your body, a way to modify that one a little bit is still lying down, but if you bring your feet a little further than hip width apart, again on a bed if you don't want to do this on the ground, and now just let those knees drop in towards one another. Might have to go a little wider. There we go. Now I feel a stretch. You're stretching both sides, but again, a little bit less aggressive because you're not placing any pressure through any of the joint area. A final option, if neither of the lying down ones work for you, is standing with a sturdy chair and probably, again, something to balance with too, or not balance, to help so that you don't have to lose your balance. But again, if I'm stretching the left leg, this will get into that hip flexor a little bit too. If you take this leg up on a chair, and then you're actually rotating the bottom part of the leg out, and then adding that little tuck with it, you're now getting more into here. My chair is unsteady too, so the more you rotate that, the more you'll repeat or similar to those ones right on the ground. Thank you so much for tuning in today, you guys. If you want to get rid of pain anywhere in your body on your own with just one little portable device, don't forget to check out the Derma Edge. I created this while I was going through Lyme disease to help get rid of my pain on my own, nice and gently. It's patented and made in the US, actually right down the road in Laconia from where my office is. So don't forget, you can click the link here or in the description to order your own.